Health and Wellness Center, and this is Life with Jason Clemmons, DC, on this Wednesday, November 13th, right here in Lubbock, Texas, at the Rock Health and Wellness Center studios, and on the radio at 98.7 Walk by Faith Radio and 1420 AM Lubbock Christian Nation, 987radio.com. We're on Facebook. We're on social media all over the place. X, YouTube. You can, if you want us, you can find us. And hey, I hope everybody's good today. Hope y'all had a great day. I had a great day. It was busy as heck. We started early this morning. Had 2 new patients. Was rocking all day long, and so it was really good. I'm glad I got to finish about 15 minutes ago and got to hear the end of Robert Pratt on the radio. Kind of take a deep breath, get ready for this next hour, see if we can talk about some health. And welcome to all the people who are new to the show, all the new patients who are just finding us. Welcome to you guys. If you're finding us a little bit later, you can go back. You can go all the way back to last September. And on our Facebook page at the Rock Health and Wellness Centers, Ken Adams shares a lot of our stuff on the Walk by Faith Facebook page. But you can go to the Rock Health and Wellness Centers and you can find us and you can see all of our stuff. And you can go on YouTube and it's all there all the way back to last year, September 1st, when we started. So if you want to learn about health, you just listen to a lot of those first shows. It's hard. It took me forever to get my video and my audio worked out. I think I finally got that done. So these last few months, we've gotten that under control. But some of those other ones, the video and the audio is off, but the content's good. So hey, it's been a good week. Monday night we took health to church, and we went over the sermon about listening to the Lord, and so I've been applying this week, and I got a great story for you guys. So last night, so just in case you don't know, the Monday night show, Take Health to the Church, we take Sunday sermon and we talk about it from a health standpoint. And so the Sunday sermon was about Shema, we're saying that, I think that's how we say it. Rest, listen to the Lord, right? And because it's running on empty. That's what they're talking about, running on empty. How can you fill your tank? So this is a great story. So I decided, all right. So he shared Deuteronomy 6, verse 4. Hear, O Israel, the Lord our God, the Lord is one. Love the Lord your God with all your heart and with all of your soul and with all your strength. These commandments, this is where it got me right here. It's like, okay, these commandments that I give you today are to be on your hearts. Like, when? When should this commandment be on your heart? All day long, every day, always. It's like, okay, I'll try that this week. I'll try it, right? It's like these commandments should be on your hearts. Impress them on your children. Talk about them when you sit at home and when you walk along the road. And that's what we're doing tonight. We're walking along the road with each other. I was like, hey, he's trying to tell me something. It's like, hey, I'm trying to tell you something, you little hard-headed dude from Roswell, New Mexico. Would you pay attention to what's going on? East Texas, Oklahoma to Roswell. There's a little triangle going on right there, right? So I just been trying it this week. All Sunday afternoon, I kept saying that to myself. I just kept repeating that. Love the Lord with all your heart. Love the Lord with all your heart. And then go to bed at night, say that prayer. Get up in the morning, first thing, say that prayer. Just read that scripture, say that prayer. That's what I've been trying to do. It's Wednesday. I know some of you guys got to be shaking your head like, golly, this boy here is wacko. But no, I don't know if some of you have. I know some of you guys have done it, but I really, it's been solid all day. Every time I have a thought that's not about loving the Lord, I stop and I just say, love the Lord with all your heart. What are you doing? What are you doing? Stop your whining. Stop your complaining. Stop your griping about stuff. Love the Lord with all your heart. Okay? So last night, we've been having trouble for the last, I don't know how long, 6 months or a year or something. We've been having trouble with our washer machine at my house. And I don't do the laundry. Leslie does the laundry. Only if I have to do I do the laundry. But she does the laundry. And we've got these newfangled washing machines are ridiculous because they're all digital, right? And then the board goes out or something and gets all dusty in there, or whatever the problem is. And then you get all these signals and your washing machine locks up on you, and you're it's irritating. You start the cycle and then you go in there in the other room, you come back to check and see how the cycle's going, and it's just dead. It just stopped and it's flashing some alert signal. So not too long ago, I did a show and I talked about how my dad never fixed anything, and I was talking to you guys about how we never set the breaker in from our bathroom when we plugged in our hairdryer and the outlet went off, and then you remember that story? And I said, "Hey, Mom, the outlet doesn't work in the bathroom," and she's like, "Tell your dad." And I said, "Dad, the outlet doesn't work in the bathroom." And his solution to that was use the outlet in your bedroom. Right? You guys know that story. So for 9 years living on that ranch, we didn't have an outlet in the bathroom. There's 3 of us, my brother, my sister, myself, 3 bedrooms, 1 bathroom, no outlet in the bathroom. You have to use your bedroom outlet. My dresser my dresser was a slender set of chest of drawers, and it had a top on it that the top of it flipped up, and there was a mirror on there. And we got that set of furniture when I was about in 3rd grade. We were living in Oklahoma City when I got that set of furniture. And that was my mirror in my bedroom. I just now, in this very moment, I just thought to myself, you could have bought another mirror and put it on the wall. I didn't think of that when I was growing up. So as I grew taller from 2nd, 3rd grade until I was a senior in high school, I finally outgrew that mirror. And so I had to stand in front of that mirror with my feet spread way apart so that I could get short enough so that I could see my hair, so I could dry my hair with my outlet in my bedroom, because I didn't have an outlet in my bathroom. That's a true story right there. I've never told anybody in my life that story, but that's true. I had to try to get myself short enough so I could see my hair in the deal, right? So I told that story, and the only thing that had happened is the breaker box back in the laundry room on the other side of the house had tripped. And nobody looked at that for 9 years. I went to college. I learned what a breaker box was. I came back from college, and I forgot, and I went to plug my hairdryer in. That's back when I used to have long hair, like, longer than this. And so I went to plug my hairdryer in, and I was like, I wonder if anybody's ever checked the breaker box. So I walked through the house and went to the other room and opened up that closet, and it just tripped. And all I did is just flip it back over. And then I went in there and said, hey, y'all, our outlets work in the bathroom. That's the way it was at my house. So I was telling that story a couple of weeks ago. I don't know, a little bit longer. And I was talking about how my dad never fixed anything at my house. It was just like, if you broke, you just go in your bedroom. That was his solution. We're not going to fix the outlet. We're not even going to look at the outlet. We're not going to take 5 seconds to even think about the outlet. We got other things on our mind. We're not going to worry about that. So I was telling that story, and it convicted me. Dude, your wife is having trouble with the washing machine. So I went home and told her, I said, hey, it's time for you to get a new washing machine. We need to solve this problem. I don't want to be like my dad and never fix anything. So I said, oh, my dad, I'm not talking trash about my dad. It's just the way he was. But so we got a new washer and dryer, and they delivered it yesterday. And I installed it last night after I got home from work, which, you really, really should just let the guys that know how to do that install it. You think it's simple, but it's a little bit less simple than you think. So anyway, we have just enough room, because we had 27-inch washer and dryer, but now we got 28-inch washer and dryers, and we have a a cabinet. We got a wall on one side. We got a built-in cabinet on the other side. You got 56 and a half inches, or 56 and 3/4 inches is how wide that is. And so we measured and did all this stuff. So I go and put the washing machine, get the washing machine. Of course, it's heavy as heck, right? And I'm in there by myself, and we're leaning it, doing all this stuff. I get the washing machine, everything hooked up, all the hoses, everything, get all that handled, go to get the dryer. And when they built our house, they put the inlet, the duct for the dryer inset into the wall. So we don't have a wall coming down and then a duct just coming out of the wall that you hook the duct to. We have an inlaid. It's built into the wall, so it's just smooth with the wall. But it's the pipe that they used for the ducting was too big for the width of the wall. So the solution to this, I guess, I don't know. You guys know more about plumbing and all this stuff than I do, but their solution was to just squeeze it down and turn it into an oval. And so the pipe that's coming out, I don't know if it's made that way or if that was their solution to do it. Whatever, it doesn't matter. It doesn't matter. It's an oval. Okay. Well, the duct, the new dryer duct that we bought, that Leslie went to Home Depot and got last night, didn't fit over the oval. Now you guys know what that's like. You're in the first of all, you worked all day long, right? You should have went and changed your pants and got your old pants on and got your old tennis shoes on, but you don't. You're in your working your slacks that you wore to adjust patients all day. You got your new tennis shoes on. You're thinking, this ain't going to take but just a second. Surely I could just hook this dryer up and this washer up. So you already took too long to do the washer. So now you're sitting there in that cramped, confined space, trying to get that stupid duct that stupid round duct onto that oval feed, whatever. It doesn't fit, and you can't reach it. And there's only about a 1/4 inch behind the wall. And of course, what are you going to do? You're going to scrape the back of your hand. So now I scrape the back of my hand, and my hand's bleeding up against the wall. And I got little blood stains on the wall where my hand is rubbing against it. I'm bent over sideways. I'm sitting there. My hip is cramping up because I'm all turned sideways. But if I get on my knee starts hurting, right? And I'm thinking, I'd like to beat the crap out of this guy. Who in the heck idea it was to give this oval pipe and trying to fit this round deal on there. And then I'm thinking to myself, well, these guys that know how to do this probably could do this in 15 minutes. And you're sitting here 45 minutes later, all cramped up and mad. But the moral of the story, I know you guys are like, what is he talking about? The moral of the story is, I just kept reciting this scripture in my head over and over and over again. I just kept saying to myself, love the Lord with all your heart, with all your soul, with all your strength. Just look, you're just putting a duct in. That's it. It's just material things. It's not, no one's sabotaged you. No one's mistreating you. No one's causing, this is not a big deal. Just love the Lord with all your heart. I just kept saying it. Every time my brain would want to hit that guy that put that in like that, I just would say it. Nope, don't do that. Don't do that. Say it. Say it again. Say it again. Say it again. Say it again. And I could just feel my blood pressure just start to go down. I could feel my anger just start to go down again. I could feel that tension that was building up, just calming down. It just was calming back down. And I was like, it's amazing. That's amazing. Because, it's really easy to get frustrated, right? What is frustration in your brain? What's the neurology behind that frustration? The neurology is you're asking yourself to do something that you don't have a pathway to do, which is very irritating to the brain. But it wasn't near as irritating to the brain when I kept quoting that scripture. The more frustrated I get, the more I just would quote the scripture, and then it would just be like, it's all right. And then I was walking out to the garage to get something, and Caitlin said, "How's it going?" And I said, "It's not going good, but I'm loving it with all my heart." I think that's what happens to us. I am a testament in these 3 days so far. I'm a testament that this right here is peaceful. This is peaceful. Like, just keep saying it every time you get distracted with what you're supposed to be doing. Just say the scripture every single time that you get distracted. Just do it again. Just love the Lord with all your heart. Just love the Lord with all your heart. As soon as you're going to decide to eat supper tonight, just say it. Just love the Lord with all your heart. There's action steps in it, right? So it got me through putting the dryer. I got it in there. I don't know if it's going to work or not. I had to cut the front of that duct, and this was super funny. This was super funny too, because I cut the duct, the little hose, with my pliers. I cut the front of it, and I finally got it back there behind that little pipe coming down. And then I got the clamp on there, and then I went out into the garage, and I got duct tape. I put duct tape on duct last night. I don't know if I've ever done that my entire life. I thought that was hilarious. I just busted out laughing. I'm like, this is called duct tape. I've used it for every other thing that you can imagine, just like you guys have. I've used it for everything in my whole life. I've used duct tape for, except for on a duct, until last night. And last night, I'm pretty sure that it's the first time I haven't put it on a duct. Man, see, sometimes you can just get a kick out of some of this stuff, right? It's like, hey, I'm putting duct tape on a duct. I thought that was pretty funny. Like, I don't think I've ever done that before. I wrapped that dude up. Who knows? It probably blow off. The whole thing probably fall apart first time we turn the dryer on. I don't know how it's going to work. But it's on there. It was on there last night for a second. And we'll see how it goes. And then any of you smart people out there that know how to fix this problem, someone said you probably had to get some flexible duct or something and stretch it on there. I was like, boy, I wish I would have known that existed last night. I'm trying to get that little metal thing, that aluminum foil looking duct thing, to try to fit over that. It helped. So I went to bed last night, 11:04. I finished that project and got done, went to bed, got in bed, read my scripture, read my little prayer, got up this morning, read my little prayer, and been saying it all day long. It's every time I've started to get off track, I've just said, love you, Lord, with all your heart. And then it just puts you right. It's been amazing. It's been really cool to try to do it with my patients today. I try to remind myself every time I was with a patient, love the Lord with all your heart. You should try it. If you don't have anything else to do, you should try it. You should try that tomorrow. Just try it starting right now. Just go read that scripture, Deuteronomy 6:4. Read that scripture and just try that. See if it doesn't. What if lowering your blood pressure was as simple as that? What if decreasing adrenal gland function was as simple as that? What if your acid reflux problem was as simple as that right there? Because we can map it. You guys know we can. We can all map it back to that right hemisphere and that overactivity and that lower amygdala and that whole thing, how it works, right? Maybe if we just remembered the end from the beginning, maybe if we already know we already won this thing, maybe that we're here to shine our light bright into the world, and we just reminded ourselves every single second of the day. We just kept it on our hearts. These commandments that I give you today are to be on your hearts. When? All the time. Talk about them when you're walking down the road. So that's a good start to the show. Hey, so I got some stuff. I got a new article I want to break down tonight. I just got it. I just saw it. I'm interested in learning it. So that's kind of what I had on my mind. But before I get to that, let me just remind everybody the sharing tree. I mentioned it last week, and I forgot to mention it this week, and I need to do it every night. I need to try to remind myself. Hillside Church does a thing called the sharing tree, and you can go to hillsideonline.com/sharing tree, and it's to buy presents for kids that might not get presents or families that might not have enough money to get presents. And you can click on whatever city you're in, Amarillo, Canyon, Clovis, Lubbock, and pick up a candy cane or two in the lobby of our campus. Register your candy cane here using the tag number. This ensures every child receives a gift. Purchase the gifts listed on your candy cane. Return both the unwrapped gifts and candy canes to our campus by December 1st. So if any of you guys are interested in that, you guys want to buy some toys for some kids that might not get one, I think it's great. I mean, what else? What else is? That's super cool, right? Whatever you want. And if you don't want to go by the campus and you don't want to get a candy cane, just take them a toy. If you're interested in it, that's something. So hillsideonline.com sharing tree. If you're interested in bringing joy to a little kid. So I wanted to just mention that before we get into the article. We had some good conversations today with people, all kinds of stuff. We were super busy. We had those same conversations about the 6-3 stuff and the seed oils that we talked about last night. If you missed that show, you can go back. I showed a link to Kenobi, I think is what they said today, is Chris Kenobi, Knobbe. But he's a researcher, a doctor, and a teacher at the University of Texas at Southwestern in Dallas. And that's it's one of the best seed oil things I've ever listened to. So if you're interested in that, you can go listen to him, and he can break down seed oils for you, and you can learn about that. So let's get into this article. We're going to touch on it before the break, and then we're going to get on it some more. But I just saw it, and I'm just super interested in what it's going to say. And I think maybe you guys might be interested in it as well. So this is the title of the article is Cervical Angina, a literature review on its diagnosis, mechanism, and management. This comes from the Asian Spine Journal, August 2021, volume 15, number 4, pages 550 to 556. And there's a whole bunch of doctors from the Department of Spine Surgery, Renji Hospital, Shanghai something University School of Medicine, Shanghai, China. So that's where this comes from. Key points from the article. So I'm just going to kind of go through it because I want to know what it says just as much as you do. Chest pain is a common and highly challenging clinical problem in emergency departments. However, only 15 to 25% of patients with acute chest pain actually have acute coronary syndrome. Yeah, I get that a lot in the office. I said, Doc, I have chest pain, but I've been to my cardiologist. They've checked me out. They've done all the studies. They are like, there's nothing wrong with your heart. I can't figure out why I have chest pain. And so what's wrong with me, right? So cervical angina has been defined as chest pain that resembles the true cardiac angina, but originates from the disorders of the cervical spine. Cervical angina appears to be a relatively unknown clinical syndrome compared with other angina symptoms. When neurologic signs and symptoms are present, there should be a strong suspicion for cervical angina in any patient with inadequately explained non-cardiac chest pain. And I want to make very clear, right? I want to make very clear. We're talking about non-cardiac chest pain. So if you think you're having a heart attack, you should definitely call 911. You should get attention quickly. If you're having this pain, I highly recommend you see your cardiologist about, make sure you're not dealing with cardiac chest pain, okay? But if you're not, when the neurological signs and symptoms are present, there should be a strong suspicion of cervical angina, meaning that it's coming from your neck. And that's what they're going to explain in this article, I think, because I kind of scanned over it before we started tonight. But cervical angina can be diagnosed according to negative cardiac workups, positive neurological examination, and cervical radiographic findings, herniated disc, spinal cord compression, or foraminal encroachment. The first description of cervical angina without any cardiac function abnormalities appeared in 1927. See, there's so many things that we just don't understand about chiropractic. There's so many things because everybody thinks chiropractic is this back popping, back pain modality. It's just like my back hurts. Something's wrong. You're limping. You're some sort of pain. I had a patient that I'd take care of him and his wife for the longest time, and their daughter comes in and he tells me, well, she started athletics today and now she's hurting, so she wants an adjustment. And I was just too busy to address it. I was too busy. If that would have been my daughter at my house, I'd have told her to go back in her room. I've done that before. My kids come out of the in the hall when they were kids and their dad, my back hurts. Can I get an adjustment? I was like, get out of my face. Get on out of here. Go back into your room. Don't ever ask me that again. Hey, luckily, we're on a break. You're going to have to come back for the second half of the show if you want to see me get out of that one right there. But yeah, this is Life with Jason Clemmons, DC, and we'll be right back. Sorry, y'all. I wasn't paying attention to the clock right there. It just busted in my, as soon as I said that, it just busted in my ear. I probably should have been saying love the Lord with all your heart when the kids were growing up. They probably would have been less traumatized with some of the stuff that they were traumatized with. But no, the point of that is, it's like, look, I'm a wellness doctor. I'm a nervous system doctor based in functional neurology. I'm a nervous system doctor. I'm not a back pain doctor. Back pain is one part of the nervous system. It's not the end all be all. And I know by now you guys are like experts because y'all are original gangsters on this deal. Y'all are the originals, right? So you know better than to think about chiropractic as back pain modality. It's nervous system function. And how many times have you had chest pain and you thought about, hey, I wonder if my cervical curve is right? We've got the cervical curve question up on the TVs here in the office, and right now we're on a break, so I want to make sure the radio people get back with us. So we're just kind of filling this time, but we got our TVs in the office. We've got the questions up, and one of them, what is the measurement of a proper cervical curve? And I've got like positive 15 degrees, 0, and negative 42 degrees. And it's amazing how many of my patients don't know the answers to that question. They get it wrong. And it's like we talk about cervical curves for 20 years. We've been talking about cervical curves. Minus 42 degrees. The minus part is the reversal part, like not a reverse cervical curve, but that minus part is if your head is like this and your neck is straight. If your neck is completely straight, if you bend it backwards, if you make it go this way, that would be a negative. If you make it go this way, that would be positive. And you don't want that to happen because what you want is a cervical curve that goes backward like that. You want this. And that's kind of what we're talking about tonight with this whole thing. So let me get us back on air. Okay, everybody, we're back. This is Life with Jason Clemmons, DC. We're talking about chest pain that might be caused from what's going on with your neck. Okay, and what I was saying before the break is, how many times have you ever actually thought about that? This description started in 1927. Like your cervical curve, the status of the way that your neck is in relation to your torso, that could have something to do with your chest pain. And I would be willing to venture that a lot of people never think of that. They never think about their posture being contributing to some of their negative health outcomes. Because and especially they don't think about it being affected or related to chiropractic care. And that's what I was saying before the break. It was like about when the kids would come in and say, Dad, my back hurts. Can I have an adjustment? I'd say, go back in your room. You get adjusted because you're subluxated. Like you have interference in your nervous system. So they would leave and they would go back in their room, and then they would come back out into the living room and they would say, Dad, I'm subluxated. Can I get adjusted? And I was like, yes. Because I didn't want to teach them that crap. I didn't want to teach them this nonsense that your body's working perfectly unless you're in pain. And if you're in pain, then your body's not working perfectly. That's not true, right? So let's get back to the article. The presentation of these patients, how do they present? Patients with cervical angina often present with anterior chest pain that has been described as sharp, achy, or crushing in quality. The pain may be present at rest or exacerbated by cervical range of motion or movement in the upper extremity. So when you move your neck around, it hurts, it makes your chest worse. Or if you're moving your arms, especially if you're trying to raise your arms above your shoulders, then it would make your chest pain worse. Other symptoms may include neck pain, upper arm, radicular symptoms, meaning like it runs down your hand gets weak, you got your fingers are tingling, you got numbness and tingling in your hands, and occipital headaches. The occipital headache is this headache that starts right back here at the base of your skull. So if you stick your finger in your ear and just go backwards, go around to the back of your head, or just put your hand on the back of your neck and where your little fingers are touching your skull, that's your occiput. And occipital headaches start right there, and they usually will come right over the top of your eye and come right in behind your eyeball. And when you get an occipital headache, it's just miserable. Like makes you want to close your eye because it's like, ow, that hurt. It's like comes around to the top of your head and it's starting from back here, right? And you've got all of your posterior muscles all attached right there to the base of your skull, and then those muscles will cramp because your head is forward and those muscles are pulling all day long to try to pull that back. And if that happens, then anywhere that whole muscle bundle that's coming from the top of your head downward, if it hits those nerves, you're going to get pain that's going to run into your arm, or you might get some chest pain, is what they're saying here. So more than half of patients have been identified to experience autonomic symptoms such as the changes in breathing, nausea, vertigo, eye problems, and other symptoms. Okay. The patients usually have restrictive cervical motion, paraspinal tenderness. Yep. You reach those muscles, you got those trigger points and everything, and or positive Sperling maneuver. I won't get into that. Common manifestations associated with cervical angina include neck and arm pain, upper arm radicular symptoms and fatigue, and tenderness and occipital headaches. The diagnosis, varying degrees of cardiac workups must be performed in order to rule out the true angina pectoris, right? You want to make sure that you get checked out by your doctor because you don't want to be having a heart attack. The use of coronary angiography has enabled us to rule out heart disease as the cause of chest pain more often and with greater accuracy than in the past. Cervical imaging can be critical evidence in the diagnosis of cervical angina once coronary artery disease has been ruled out. Routine cervical MRI examination has been recommended for the functional assessment of cervical angina. Now, that wouldn't be the first thing that we would recommend in the office. I'm not going to jump. I'm like, for me, getting an MRI immediately is like, you have to have some very specific circumstances. You've got to be an outlier as far as that goes. After 20 years in clinic, I don't need an MRI. I could tell right off the bat. I had a lady ask me today, because I saw her husband one time. She came into the office. He's an oil field guy, and he's a hard working, good dude, by the way. But I only saw him once, and then I haven't seen him since August. And then he came back in today because he was off work, and his shoulder hurts again. Same shoulder that was hurting the first time. And she said, when you took an X-ray of his shoulder, did you see anything? Well, I didn't take an X-ray of his shoulder. I took an X-ray of his neck, because I don't need an X-ray of your shoulder. The public has been sold. The public has been sold a bill of goods on X-rays on certain joints. Look, what's the mechanism of injury? Did you break your shoulder? Nope. Didn't do anything to break my shoulder. Didn't fall, didn't have any problems, didn't get tackled, didn't flip a four-wheeler, didn't get bucked off a horse, none of that stuff, right? Am I worried about having some sort of break? No. So the medical model is going to say tumor, fracture, dislocation. Now, I can't rule out the tumor, so I could take an X-ray of his shoulder just to wonder if there's a tumor in there. But fracture and dislocation, I don't need any help with that, right? If I'm going to take an image of a shoulder, I'm going to take an image. I'm going to send them for an MRI to see what's going on, because I want to know the soft tissue stuff, right? But that's not the first thing. It says routine cervical MRI examination has been recommended for the functional assessment of cervical angina, but routine cervical MRI is not routine, in my opinion. And MRI may demonstrate degenerative changes in the cervical spine, including herniated disc, spinal cord compression, or foraminal encroachment. Yes, now, those things are something that you can see on an MRI. But you can clinically tell if a person's got a herniated disc or cord compression by some of the clinical things that you could do in the office as well. MRI may demonstrate degenerative changes. Yeah, degenerative changes are frequently found in the asymptomatic population, and functional tests, discography, selective nerve root block, may help to confirm the etiology of cervical angina. Discography and or selective nerve root block are invasive tests which are not risk-free and should be considered carefully and only applied in patients contemplating surgery. Yeah, we're not going to start with any of that stuff at the Rock Health and Wellness Center. Like, we're going to adjust the cervical spine. That's a medical model thing, that injections and all that stuff, like, it drives me nuts. Nerve root block, man, no, not unless that's a worst case scenario, a nerve root block. I'm not going to take a needle and stick it in there and block your nerve root. That nerve goes to your brain, right? Like, we're going to try some other things first. I'm not saying that there's not a time and place for that, but we're gonna try some other things first. Number 9, mechanism of chest pain. Most cases with cervical angina have been attributed to cervical nerve root compression. Since 1934, it has been suspected that cervical angina is linked to compression or irritation of the anterior motor efferent, right? Motor is from the brain to the body. That's the efferent nerve root by the uncinate process, the joint of Lischka. I'll show you that picture in just a second. So that's what they're saying, is that they think the cervical angina is linked to compression or irritation of the anterior motor or efferent from the brain to the body nerve root. Compression or irritation of the anterior nerve root can induce diffuse pain. The pain is not clearly radicular, but is less discrete, which may be referred to a muscle innervated by the cervical myotomes, resulting in precordial pain. What are they trying to say out there? The pain is not clearly radicular, which it's like, okay, is it down to your little finger? Is it in, are you getting it to your thumb? That's what they're talking about would be clearly radicular. It's less discrete, which now it may be involved in other areas. It may be going to a muscle around your heart, in your chest. You could be getting that from the nerve root that's innervating the muscle, right? Just do the old goofy thing that, like, make your pec muscle. Just put your hand on your chest and do that old stupid thing that weightlifters do and goofy guys do, like make your pec muscle flex, right? How do you do that? How do you make your pec muscle flex? How do you make a muscle flex at all, right? Your brain's doing it. Your brain's sending a signal, a motor efferent signal from the brain down through the spinal cord, out the nerve root, innervating the pec, boom, and now the pec contracts, right? So it's logical to think that if I had some sort of disruption between those somewhere in that area, that I actually could have some chest pain right over the top of my heart that mimicked a heart problem that's not a heart problem. And I might have chest pain that's due to the fact that I've got some sort of disruption in my cervical curve. Yeah, and that's since 1934. Compression or irritation of the anterior nerve root can induce diffuse pain. Yeah, we talked about that. Cervical angina may be mediated by the cervical sympathetic afferents fibers to the heart and coronary arteries. It may be mediated by the cervical sympathetic afferents. So that's to the heart and coronary arteries. Other autonomic symptoms such as nausea and diaphoresis, the change in your breathing, can occur and are mediated through the sympathetic nervous system. Yeah, so now you got this. We know that, right? So we know the sympathetic nervous system speeds up the heart, speeds up the breathing, increases the blood pressure. The parasympathetic nervous system slows all that down. And it's sometimes in certain circumstances, in certain blood vessels, that's not 100% true, but overall, that's the kind of way that works. This occurs from compression irritation of the sympathetic fibers that travel in the anterior root, or from the plexus of sympathetic fibers that are anatomically associated with the longus colli muscles. Those are muscles that are running around your neck. Referred pain may be mediated by the sinovertebral nerve, which is a branch from the initial part of each spinal nerve passing in a recurrent fashion back through the intervertebral foramen to supply the spinal meninges. That's hard for you to understand. The posterior longitudinal ligament, posterior lateral periphery of the intervertebral disc, and periosteum of the vertebrae. So we've talked a lot about anterior longitudinal ligament, the ligament that's running on the front part of the spine. You also have a posterior longitudinal ligament, which is on the inside of the spinal canal that runs all the way down. Some cervical angina patients have hyperplasia of the Luschka joints in their degenerative cervical spines. I'll show you that in just a second. It is reasonable to speculate a close association between cervical angina and the Luschka joints osteophytes, meaning bone growth on there. Protrusion of these joints osteophytes jacks up the homolateral longus colli. I don't know if they really meant that to mess it up. Might compress and stimulate adjacent sympathetic afferent fibers to the heart and coronary arteries and result in cardiac chest pain. Conservative treatment has been determined to be successful in most patients with cervical angina. At least 3 months of conservative treatment is recommended in all but most severe cases. Conservative treatment should be continued as long as the patient's condition improves. Surgical intervention may be recommended if conservative treatment fails or in cases where neurological compromise is evident by spinal cord or nerve root compression. Let me make a point right there. And I said this to Leslie this week. Look, there are physical laws that run the body. There are physical laws that apply to the body. One of them is elasticity. Just take your hand, take the skin on the top of your hand, and it doesn't even matter how old you are. The older you are, the less elastic that skin is going to be. But just pinch that skin up on the top of your hand and then let go. The skin goes back to normal. If you're old, it might take a minute, but it'll kind of work its way back to normal. That's the elasticity in the tissue. There's also plasticity that has to do with plastics, and there's viscosity that has to do with fluid. There are physics laws that apply to these things. When you adjust a patient, when you take a person through a range of motion, you get to that paraphysiological space, you add an adjustment to the patient, you are going to move a joint through a certain range of motion. You're going to fire the nervous system. There's going to be a symphony going on in the nervous system, but the person's elastic properties of their tissue is going to move them back to where they were. That's causing the disruption in the first place. It's kind of like this microphone. If this microphone is too close to my face and now it's popping on the radio because I'm too close to the microphone, and I was to adjust it and push it back away from my mouth a little bit so it's not so loud, and there was some sort of elastic property to the tissue would start to pull itself back over, and now the microphone's too close to my face and it starts popping again. So you'd have to push it back over. In chiropractic, the frequency of adjusting is just vital to outcomes. It's vital to outcomes. And I did not make up this law. Me as the chiropractor, I'm not the one that made up this rule. I'm simply trying to share this. It's like, and it's different. It's different than you've got I don't know. You've got something. Let's say you got some sort of pain. You've got back pain. Okay, you've got back pain. You go to the doctor. The doctor gives you an anti-inflammatory and a muscle relaxer, whatever, painkiller, and you go home and you take these medications, and now your back pain goes away. Okay? Chiropractic does not work that way. First of all, no one ever figured out what the reason for the pain was, but it's like, dude, that's not the way it works. We're so accustomed to that model that when your chiropractor says, I need some frequency, I need to see you multiple times this week in order to get the tissue to overcome the elastic properties of the tissue, right? Because I'm going to adjust you, and it's going to overnight, 24, 48 hours, that tissue is going to want to pull itself back. I'm going to adjust you again. It's going to want to pull itself back. I'm going to adjust you again. It's going to want to pull itself back every time. It's kind of like pushing someone on a swing. They go away, but they come back, but they don't quite come all the way back. And then eventually they settle in the middle. Now, the more your chiropractor knows about how the body functions, the better that the tissue is from a nutritional standpoint and a fitness standpoint, the more proficient that your chiropractor is, the quicker you can get the body to stay in that position. But Jesus is the only one I've ever heard of that just lays his hands on you and bam, you're healed. It doesn't work that way, right? And this is what this article is saying. It says conservative treatment has been determined to be successful in most patients with cervical angina. At least 3 months of conservative treatment is recommended in all but the most severe cases. Yeah, so 3 months. Like, look, and that's not one adjustment a month either. Like, it's repetition in time, right? It's just how it works. And I'm sometimes you think, and sometimes people think, sometimes they set their own frequency and they don't have any idea what they're talking about. I'll tell them, I say, I need to see you multiple times this week. And then they'll go up to the front and they'll make an appointment with Leslie, and it'll be next Thursday before I see them again. And then they'll come back in and they'll say, Doc, well, my back still hurts. My shoulder's still, this guy that I was talking about today, I saw him in August. His shoulder hurts. He came back today. Doc, my shoulder still hurts. Okay. Like, it doesn't work that way. It's just the way That's just the way it works. It's like you need frequency. If you really want the best outcome, you got to get the frequency in the beginning of acute care. Okay, that's what these guys are saying too. In a series of 438 cases with cervical angina, the levels of involvement were 37% at C5-6, 30% at C6-7, 27% at C4-5, which makes sense. C5 and 6 is the number one area of degeneration. C5 and 6 is where you get the most of the reversal of the cervical curve. Remember, we've shown it before, the reversal of the cervical curve. Here's C2, C3, C4, C5, C6. Look, in this particular cervical curve, yes, C5 and C6, the disc at C5 and C6 is the most compromised because of the reversal of the cervical curve. And that's what the article is saying. The article is saying is that 37% is right there. What does it say? 30% is between C6 and C7, and then 27% is up here at C4 and C5. So that's what that's talking about. All right, I'm gonna move on down the article because I want to show you these pictures because this would be super cool for you. There it is. Conclusions by the authors. The possibility of cervical angina should be considered once myocardial ischemia is ruled out. Very important. See your cardiologist. In patients with inadequate explained chest pain, especially when neurological signs and symptoms are present. It is essential that more family doctors, internists, and spine surgeons are more aware of this condition. That'd be great. Send them to your chiropractor. Lisca joints osteophytes may be one of the pathogenic factors of angina. So here's a picture, and I know you guys on the radio, we're looking at a cross section of a vertebral, a spine really from top down. So we've got the disc, and here's the front. We got the disc. We've got the spinal canal. We've got the anterior root coming through here, right here, and it's going through this little, and you got the uncinate processes, which is a little part of the bone that's going on right there. You got the longus colli muscle, which is running long ways right next to your spine. You got sympathetic nerve fibers that are on the outside of that longus colli muscle. So you got the facet joints that are back here in the back. So that cervical spine there's some things going on right there, right? And we might come back and look at some of this later. But now you can kind of see the Lisca joints and how its osteophytes hypertrophy can affect the adjacent sympathetic nerves, which might result in cervical angina. So what we're showing in this picture is how now you might get some extra bone spurring. And I saw it multiple times today. Some extra bone spurring on the cervical spine that is also affecting those sympathetic chains right there, because this is not functioning properly, and now you're getting those nerves involved. So there's the vertebrae, here's all your muscles coming down, here's the nerves that are going along with it right there. And then Dr. Murphy's awesome because he always gives us the neurological pathway of it all, right? Anterior nerve root coming into motor to the muscle, and pain from musculoskeletal tissues is firing back into the posterior nerve root. That's where it's going to be processed in the brain. So we got preganglionic sympathetic fibers that are coming around, sympathetic chain ganglion that are coming around, and now we get this heart postganglionic sympathetic fibers to the heart. That's one of the things. Remember, I said yesterday, I think it was yesterday, the day before, the sentences that I've heard over and over. One of the first things that got me to understand chiropractic was my brother-in-law doing half-hour to health classes and asking patients if he could cut the nerve that goes from your brain to your heart. And everybody said no. And I was sitting there thinking to myself, there's a nerve that goes from your brain to your heart? What is he talking about? I thought your heart was your cardiovascular system. It pumped blood throughout your body. It took oxygen to your tissues and all that stuff, right? What does your nervous system have to do with the way your heart functions? It's like, look, there's the pathway right there. Like, there's the drawing of how your nervous system has to do with the way your heart functions. And if I took a nerve and if I took a pair of scissors and I cut that nerve root, your heart would function differently. And if you don't understand that your nervous system has something to do with the way your heart functions, if your heart malfunctions, you may go to somebody who does some sort of procedure on your heart that your heart doesn't need. Just because your heart's not functioning properly and because your nervous system is putting pressure on it. Does that make sense? I hope that does. I hope that makes sense right there. Like, your nervous system controls every single cell and tissue in your entire body. And if you're serious about your health, you're serious about your nervous system. Hey, that's all we got for you tonight. That's the end of the show. I hope that was helpful. Hope you guys got something out of that. We'll be back tomorrow night at 6. If you got anything you want to talk about, send me a message. Otherwise, I will see you guys tomorrow night. Thanks for watching this show.